private health facilities. You wanted to get the difference between our association and Uganda Medical and Dental Practitioners Council.
Or how you relate?
How we relate. Yes, the UPMDC is a regulatory body. It regulates the facilities that we operate. They are the ones that license, they do supervision, they do monitoring of the activities that take place in our facilities, and on which some of the roles we share with them. Actually, we assist them under a self-regulatory mechanism with an association. I hope you got the difference between those two institutions.
Which is superior to the other?
Well, we are two independent bodies, but they are, since they are regulators, I would say they are more superior than us.
Mm-hmm.
Yes, they've said most of what we have. Actually, we had an input in their report, but I would just like to paint this picture that as a consequence of the COVID-19, private attendance in private health facilities has drastically gone down. This is attributed mainly to the perception that health facilities are a source of COVID-19 infection, among other reasons. Because our source of revenue, our source of financing is almost entirely from the service fee collections, our revenues have really gone down, and with that we've had measures that we've taken in response to that, like staff layoffs, stopping some services that we are providing, and amidst the low revenues, we are facing high costs of operation. Costs like having to transport staff to their places of residences and back to the facility, and there are also costs of ensuring that our staff are protected by having the PPEs. So, with that in mind, many health facilities are facing a big financial challenge. Many have closed. A number are really constrained. So, I just wanted to bring out that picture that we are really running in a really bad financial status.
I just wanted us to save ourselves time.
Yes.
All those we are saying, because actually these people dwell most on the private.
Private, yes,
yes, on the private. So the issues of income and expenditure, they put it very strongly. Supply of labor demand, they even ask for salaries.
Yes.
The loss of public trust in hospitals.
And then also access to raw materials and imports, PPEs, and they really spoke on your behalf. So just to save us time, if you could just look at those areas that were not touched, so that others, because we also want to ask you some questions, because now the plenary is also beginning.
I think it has all been said, I should say, but let me just stress one point, that we are praying that government comes up with a stimulus plan for the private health service providers, a financial stimulus plan, because many of us have really been constrained to the verge of closing our facilities. So maybe this could come in form of loans to the private service investors. Amidst other interventions that the Uganda Medical and Dental Practitioners Council has already mentioned. So, Madam Chair,
they asked for salary for enhancements.
Yes.
They asked for government to provide a platform to renegotiate loans.
Yes.
They asked for national referral system.
Yes.
That is for you. They asked for ambulances, more ambulances, and equipping ICU in all regional referral hospitals.
Yes.
Addressing the shortage of human resource.
Yes.
And maintaining the partnership with other stakeholders. And they also want soft loans.
Yes.
They want tax waivers on manufacture of medical supplies. This will benefit you because they will be cheaper.
Yes.
On fast tracking of the national health insurance scheme,
Yeah.
you will be the implementers. On strengthening the e-health facility, I saw it is also in yours.
Yes.
And improvements in transport and contributions to circles where your people can borrow from.
Yes.
Yes.
Virtually it has all been covered. Maybe I also just bring up one issue that we have been trying to push forward even before the COVID period. We've been engaging the Ministry of Trade so that we can have our rates for utilities subsidized. For that is electricity and water. This would go a long way in
reducing the taxes. Because subsidizing is a bit difficult on the side of government.
Well, what would work well?
You say you are engaging Ministry of Trade?
Yeah, we've been engaging Ministry of
Maybe you are
Trade.
engaging the wrong ministry.
Yeah.
You should engage the Ministry of Water and
energy.
Energy.
Because the electricity falls under energy, and then water falls under under water.
I think we need to change the direction of our energy.
For example, now that Ministry of Water has come out.
So
with
in
the water
short,
plan
you
for
want
all-
a reduction
Yes.
on the tariffs for
On the
water
tariffs.
and energy.
Yes.
Okay. Okay.
Yeah. So we've been pushing for that for some time. So if maybe Parliament can put in a voice.
Because of the effects of COVID or generally?
No, that was before even the COVID. period. Yeah, we shall go, but if time comes and there is need for Parliament to put in a voice for us, please request that
We'll
you.
put it in the recommendation. But one problem, in fact, we may have misdirected our concern with the medical council, is the ethics of
Yes.
the practitioners. The way you handle the patients. And even the professional ethics
Yes.
of dispensing your service. There are so many people who pretend to pose as a qualified medical people, whereas they are not. You enroll people, nurses, so-called nurses who are not fully qualified because they are relatives, and you title them as nurses.
Yes.
So really ethics. And we noted that one of the things people who go abroad for treatment benefit from most is the ethical standards. And you know it very well as medical practitioners that the first cure is the impression your patient gets when he gets in contact with you. Yes. But here your approach is repulsive, it is money-minded. When a patient comes, he's dying, is what he said, put here 4 million shillings. I know for one man, he died because they asked for him 4 million shillings before they could touch him. And that was 4 o'clock in the morning. By the time the people got the money at 10 o'clock, the man was dead.
It even happened in President at the International Hospital. Somebody came, needed to put money first. And the first was passed.
Madam Chair, we've been encouraging professionalism amongst our members. But yes, I understand it's not an easy issue, something that needs multi-sectoral approach or multi-institutional approach to address. But we've been encouraging professionalism. We've been encouraging our members to always cross-check with the councils before they employ their staff. And a good thing council has made it so easy that you can even verify online someone's ethics qualifications, which our members have taken on. There have been lack of awareness among some members about that, but we are happy that men are picking it up.
But how do the patients from Nakaseke come and start verifying the qualifications of your staff?
They do it on phone. To do it on phone, you just need to ask for the caregiver's name. You SMS
if
it
somebody
to.
is sick, he comes, he wants treatment.
Yeah, that's what I said.
You
That
cannot expect him to go into such applications.
yeah, Madam Chair, you're very right.
Supplementary. You see, what the chair is raising is what we
Yes.
have practically seen.
Yes, true.
This institution has benefited from health insurance.
Yes.
Out of all this health insurance, it is the private hospitals which are benefiting from it. It's purely the private hospital, not the government hospital. So, when it comes to looking for this insurance, you see good faces come, smiling faces come. Come here, you get the services, you get the services. If there are issues, let me know. But as you now acquire the insurance, you acquire the provider, you now go to the hospital, and sometimes you face a lot of challenge.
Yes.
You face a lot of. So this is actually not about pay. We expected that as you get even more money from the insurance, in turn, you should be able to provide a better service. So for me, I want to raise just one question, because when I look at this presentation, I ask our club and say, why did these people come and sit next year? So when the chairman of the medical professionals spoke, and he asked one of his members on the board, two of his members on the board, who are from private hospitals, to contribute, I thought they covered everything here. And indeed, you also listen,
yes,
because they represent you on the board, and basically everything they have presented, except the issue that they never talk about is what the chair has raised about, the issue of ethics.
Ethics.
And maybe, how can you improve ethical conduct of your staffs? How can you assure us that actually you should be doing better than the government hospital?
True.
Because I think to some extent, don't you pay your staff better than the
No. Government now pays better.
Government now
Okay.
pays a bit.
But the fact is that at least for you even recruit those who are already working in the government. You give them some time. So it is additional resource to them. So why don't you? Then secondly, the quality of some of your consultants are wanting compared to what government has. You don't want to get the real specialists, the real consultants, but you want to employ people who are lowly rated, and you call them in your hospital specialists. So long as somebody has got a master is a specialist, not necessarily. It is the work experience and the specialty in a particular area. The work experience and specialty. But for you raise so many, you give different titles to your workers. And in the process of giving that title, it can cause problems. For example, at the international hospital, when I was being referred, the medical council was actually wondering whether this person was qualified enough even to refer me. But in your hospital, you called him a specialist. That was the final man. At that stage, they actually told him, you should have consulted consultants before giving this referral. So you see where you put your members of parliament in the private through insurance, but when they go there, they hit an embarrassment and a snap, because the title there is not worth what it should be, simply because you fear paying the real consultants in your hospital.
Honorable, I understand your concern about the titles in the private sector. There is no specific policy or guideline on that. That exists only in the government.
No, but the fair. Again, that goes to ethics. In the hospital.
Don't you have standards?
Because
you are dealing with the doctors.
Yes.
who have standards. For someone to be qualified to be a consultant must have a certain standard and experience.
Now the regulatory council, that's a responsible regulatory council.
No, but you when you are establishing,
Yes.
you are a doctor.
Yes.
You are a doctor, you know that is a profession, a doctor of medical practitioners.
And that's international.
Yes, it is basically international, it is not local.
Yes.
And you must, when you are starting such a business, you must fit in it there.
Yes.
You cannot fit below that.
Honorable, that's true, but it's also very true that it's most of the consultants who are in the public facilities that are also working in the private facilities. Most of them.
But let me help you.
Yes.
To be a consultant, you don't have to have been only in Uganda. There is a degree by the time you qualify as a consultant, and it's a national norm. Because what I'm talking about is that doctors themselves, in their circles, they know who is good at what.
Yes.
Worldwide, on internet.
That's true.
Yes.
That's true.
Yeah.
Then why you get the wrong people?
Anyway, that is a point for you
Yeah, I've noted it.
to consider.
Yes.
And it's a very serious concern in as far as your consumers are concerned.
True.
Of course, the other problem is the lack of equipment, appropriate equipment. Because one of the areas where Uganda does badly is on diagnostic equipment. In fact, it's one of the reasons why people are taken abroad. We are told that the MRIs which are here are obsolete.
Oh, they are.
They are obsolete.
Of 18 something.
The equipment you are using are obsolete.
18
I have a friend who got a fracture and was operated on, and they said they put in metals, and for 3 months he couldn't get off the bed, he couldn't walk. So he went to Thailand. When they went to Thailand, they opened up the legs again, and they told him that they had put in the wrong material, and it had rusted. So they had to take it out. He even came back with those metals. According to him, he says they were for bicycles, bicycle parts.
And you see the profession is,
Yes.
even when you are going up, when you are abroad in some of those hospitals, which you should be practicing,
Yes.
if there is to be an implant in you, this ethically to be given to you the detail.
Yes.
This is this make, it
Yes.
is from this, this is this will serve you during this period. You know, like all this
And
is permanent.
And the side effects.
And it is universally accepted. And it is here. Even those MRIs, they tell you what you are going in is at this level, at this standard.
Yes.
But for you now, you know, it's really unfortunate because we embrace privatization with the hope that you will offer better services. So, if you are not ready, for example, why should you call your hospital an international hospital when it doesn't have an international standards? Really, honestly speaking, that is quite misleading. At least let the cost be high, but let it have the international standards. Yeah? So,
And the cost is too high.
yeah.
No, that's an issue
My
I've noted.
husband stayed in intensive care unit for 3 hours. But for those 3 hours, we paid 4.5 million. He came when he was almost dead. They didn't do much. They did not even put him on the machines. I think they were just managing us to give us the news. But they charged us 4.5 million. In fact, it was less than 3 hours.
Oh, that is really so high.
I can tell you,
But these are the issues.
Just another example.
Yes.
There is a colleague here who was up, he refused to get insurance in the other parliament where there was an option. So the wife wanted to deliver, and I had to go and help. Go to it was a normal delivery. Was 8 million shillings. I had to food this guy. The guy was not around. I had to support. He has not even paid me up to now. So your cost sometimes is basically beyond. But if you could put a standard, it would be
Yes, like the head of the council put it. You are regularizing the
And another thing, you
rates.
see,
Yes.
I have gone to private hospitals, and sometimes because of my PR also, you know, PR helps. It is the ordinary people at the counter, those nurses, who come and tell you, say, now your appointment has been made with this doctor. No, don't come. Don't come for this surgery. You know, this doctor is ABCD. It is happening.
Yeah,
This doctor is ABCD. Don't come. It is only when they are given doctor so and so is where you should feel confident. And that is what sends most people abroad.
Okay.
Yeah, that happens a lot.
Thank you very much
Yes.
for coming. We have heard our concerns. And of course, you are the most treasured service, especially now
Yeah.
in the advent of COVID. You are the ones to help us. So we really take your service very, very seriously and would go out to support it in every aspect to make it better and also to help you do your work professionally. Thank you. We give you a pat on the back. We have already given a standing ovation to your bosses, so by extension, it also goes to you. I thank you very much. Electronically. Yes. Thank you very much, colleagues. It's been a long session, and we have 2 loans on the floor this afternoon. Yeah, the report of Karamoja Hospital and Kampala City Council District Roads. Please be there to support. Please be there to support. Please be there.